Welcome back. New this morning, a medical breakthrough in paralysis. A company out of Cambridge, Massachusetts called Invivo Therapeutics could start human testing soon on their revolutionary technology. Joining us today is company CEO Frank Reynolds to help explain the process. Thanks so much for being with us today. Talk about this process called biopolymer scaffolding that your company is developing.
Yeah, sure. This is actually the device right here. So biopolymers can biodegrade. So we implanted technology into the spinal cord that basically does its job and then dissolves into the blood system and does its job in about 3 weeks and then dissolves in about 6 weeks and leaves the body very quickly. And for that reason, there's only a 1-year follow-up at the FDA. So this is a product that can get through to the FDA and onto the market by the end of next year. So we're very excited about that. But it turns out, you know, there's a wide range of spinal cord injuries. Some patients are going to require scaffolding like this. Some are going to require scaffolding in addition to stem cells, in combinations of cells and drugs and scaffolds. All different types of products will have to be required to treat all of the ranges of injuries. And so we've developed all of them. We actually have about 9 products. One's at the FDA right now. We have a second one going to the FDA for spinal cord injury. So we'll actually have 2 different spinal cord injury treatments at the FDA in the coming months. And then we have treatments for chronic pain and other applications for neurotrauma that we've developed off this platform. It was developed at Harvard and MIT by some of the best in the world.
And you have a personal experience that kind of propelled you into the business, right?
Yes, I was actually paralyzed in 1992 for 8 days, fully paraplegic. I could move my legs while in bed after that and had struggles walking for, you know, over 5 years in a body brace on my knee to my neck, pretty much staring at the ceiling 24 hours a day. And came across paths with people at Harvard and MIT in 2005. Bob Langer is the largest academic research lab in the world. It's at MIT. He's had over 50 products already approved by the FDA, and we're really excited about getting this one through.
And how is this one different from previous attempts at treatment?
Sure. So all the prior attempts, and right now probably about 97% of research dollars go into stem cell technologies. Stem cells are obviously the holy grail for people that are in wheelchairs today, and we're certainly developing stem cell technologies with partners. But scaffolds provide a support for those cells, and those cells survive, they thrive, they do much better. So it really is, you know, drugs can be delivered better with these scaffolds. You know, really time release is the problem that chronic patients have, whether they have a spinal cord injury or ALS or MS. All of those conditions are going to require a time release, either drug or cell. And to tell you the truth, in 10 years, our product would probably deliver drugs for the first few weeks, anti-inflammatories, and then deliver stem cells after that for maybe up to 9 months.
And that's the big selling point. It helps with the secondary sort of injury, controlling the inflammation and stuff like that.
Yes, it turns out 90% of patients don't have to be in wheelchairs for life. 90% of it going to be put in a wheelchair around day 21 after injury. So we do have a time to intervene. We'll be intervening in the first day or so after injury, but in 90% of the cases, we believe that we can mitigate enough of the scarring so signals can get through that area. And it turns out if you can spare just 10% of the spinal cord, only 10%, not 50 or 80, 10. If you can spare a little bit, the signals will get through and functional recovery occurs. I mean, our monkeys run in 3 weeks. All of the monkeys we've treated have run, and you know, we have a 3-week process that we're defeating, and they run in 3 weeks. There's no coincidence.
And trying to get FDA submitted an application for FDA approval to start human testing.
Absolutely.
Wish you the best of luck, and it's just incredible technology because it can be a very painful injury and recovery process for
it's devastating for everybody, the patients and family members. Yes.
Absolutely. Thanks for being with us this morning.
Really appreciate your time.
All right.